Good afternoon, doctors. Welcome to the next medical podcast for Clinics of CGHS. We have with us to discuss about admin question posted on the website of Clinics of CGHS. Dr. Pillai, she is a senior CMO and in charge of one of the dispensary in CGHS Pune. Welcome, Dr. Pillai. In response to our admin questions, madam, we have received many excellent suggestions and you have gone through those suggestions. So out of those suggestions, we would like to discuss with you how they can be implemented in our wellness center.
Yes, I did go through the compilations of some excellent suggestions made by our esteemed colleagues towards management of overcrowding. I suppose some of them are already in place in many wellness centers across the cities. We need to make more of an effort to implement them. Overcrowding can be due to clinical reasons or administrative reasons. Let's address the clinical problems first. Few of the things that have been suggested regarding this is like stable patients whose prescriptions are unlikely to change should be issued medicines for 3 months. They may contact us telephonically for any queries in between, if at all. It is seen that attendance is heavy in the first half of the month and sort of peters out towards the last week. All doctors must take an active effort to change and adjust the review and refilling dates of some of their patients to the last week. Over a period, this distribution will be helpful in an even attendance. Also, encouraging patients to avoid peak days and busy hours for collection of regular medicines, collection of lab forms, etc. can be done. Like avoid Mondays and Saturdays, avoid 10 a.m. to 12 p.m., use morning hours for routine collection of medicines, and etc. You have to convince them that this is in their best interest. Waiting time will be much lesser for consultation, dispensing, etc. Some patients visit the wellness center very frequently after a gap of 3 to 5 days. Either their clinical problems are not solved or partially solved, or they think that they need to be investigated more, and so on. There is need of good clinical services regarding such patients. As one of the colleagues has mentioned very correctly, quick disposal of patients to reduce overcrowding actually works against us because unsatisfied patients will return very soon. Since some beneficiaries come with demands for memos for various private consultations, tests, expensive, out of formulary prescriptions, etc. This is a difficult group to handle. It takes considerable time for a doctor to convince them that every single thing doesn't need a reference to a consultant to a private empaneled hospital, that CGHS doctors are quite capable of dealing with this. So this takes time and effort. And digital services to be used widely, which I'm sure all of the younger junior doctors are very enthusiastic about, and it should be done. We can make beneficiaries aware of good patient education videos, health related websites of common diseases like diabetes, hypertension, arthritis, which will all ensure their day-to-day problems are addressed to. A list of these can be widely displayed. The advisory committee and the pensioners association can also be requested to promote this. These days, several beneficiaries are attending wellness centers for administrative reasons also, to update Aadhaar card and mobile numbers, to inquire about plastic cards, MRC forms, etc. Beneficiaries can update Aadhaar card and mobile number through the beneficiary login facility which has been provided. Large number of people are still not aware of this. Some who know this are still hesitant to go about this. Most of the wellness centers have given wide publicity to this, have been informing patients personally. We even have displayed the steps to be taken for this simple procedure. But the response has not been very encouraging. We have to work on this more and encourage beneficiaries to take the help of their children or younger relatives to get this done if they find it difficult to do it themselves. Staff sister is a very qualified person and is mostly underutilized in most of the wellness centers. Staff sister should be motivated and encouraged to take active part in patient management, like demonstration of inhaler use, nebulization, insulin usage. They can communicate in a better way with the patients regarding the dosage of insulin, whether they are taking the correct dose, if not, why, and so on. Starting the appointment service would be really great, but it has a lot of practical issues which needs sorting out, like how many patients per doctor, what is the time allotted, what about the walk-in patients. So these things have to be sorted out. The one more thing is, if you could reduce the local purchase to minimum, that also might help us in controlling the overcrowding, because sometimes the patient comes back to collect the LP medicines and suddenly he wants to consult the doctor also for some more added specific symptoms of, or even non-specific. So these are some of suggestions that have been put through by our colleagues, which we can later on add to.
Thank you, Dr. Pillai, for discussing with us administration related problems. We'd like to have you very often on our podcasts, for especially for administration related problems. Thank you very much and goodbye.
Thank you once again.